Exercise can help. And joining us today is Dr. Gina Cadena-Forney from Providence Physicians Group in Snohomish, and we're going to discuss the importance of fitness as we age. Doctor, thanks for being with us.
Oh, it's a pleasure to be here. Thank you.
Dr. Forney, thanks again for coming in and joining us. As Maury just explained, we have an aging population out there, don't we?
Yes, we do.
These baby boomers are all, and Maury and I, you and I are one of those baby boomer population.
Yeah.
And as we get older, we need to continue to exercise, which is important. Tell us a little bit, what happens to the muscles, our muscle mass, and our muscle strength as we age?
Okay, Shannon. So as we age, there is loss of muscle mass, and this is definitely more evident in people who are not physically active. There is a loss of muscle mass of about 0.5% per year between the ages of 25 and 60. So that means that, in that 30-year period, we are losing about 15% of our muscle mass. And when you reach 60, the rate doubles up to 2%, and again doubles up at 70 to 4%, and again at 80 to 4%. When you get to your 90s, you're losing about 8 to 10% per year of muscle mass.
So, Maury, you and I are sitting here losing muscle mass as we speak.
I know. I'm just happy. I hope I get to my 90s where I'm losing 8% of my muscle
There you go,
mass.
yeah. So, how do we prevent that? That's just a natural occurrence as we age. How do we prevent that from happening?
Yeah, so there's definitely work that we can do. It is never too late to build muscle mass, because it is never too late to start an exercise program. It's never too late to get healthy. So basically, muscle breakdown can be reduced or reversed through strength training exercises.
So just because you're getting older doesn't mean you have to stop exercising, and particularly it's not just the aerobic activity, but you have to do some strengthening activity to maintain that muscle mass. Is that what you're saying then?
That's what I'm saying. Yeah, definitely. As we all get older, there are different components on the in our bodies that decrease, like our balance and strength and endurance and flexibility. So a good exercise program has to meet all those components. But since we're talking about the muscle mass, definitely the strength training exercises will help you build that mass back.
Interesting.
But what if you're, say, like in your 70s and you've never worked out a day in your life, and you go to the doctor and he says you got to start exercising? You're not talking to some guy who's 70 just going to the gym and you throw giant weights on him and run on the. I mean, it just any type of exercise, I'm guessing, is good to begin with, right?
Exactly, any type of exercising, and most of the people can walk,
right,
and that's a great exercise.
So someone in that age, if they went to a gym, probably more appropriate to work on the equipment like the Nautilus or the CAM equipment versus free weights. You're not going to be going in at 70 doing squats and power cleans and deadlifts and things like that. But if you are 70, can you build that muscle? Can you regain some muscle mass and muscle strength by exercising, or as your muscles waste or become depleted with age, so it's never too late to start working out?
Yeah, it is never too late. Definitely it's going to be better if you start exercising at a younger age. Definitely you reach your 70s and you have never exercised, then you have a little extra work to do, but you can still reduce your rate of muscle mass.
And by maintaining good muscle mass and good health, you prevent a lot of other things that can happen to your body. Can you give us some examples of some things you might experience if you don't exercise?
Yeah, definitely. Losing your muscle mass increases your chances of osteoporosis, which is loss of bone density. It can increase your risk of falls because, if your balance also decreases as you age, then you don't have the same balance, to keep your body. And lack of exercise also increases your risk of multiple conditions that we know, like heart disease, coronary artery disease, increase your risk of strokes, heart attacks, dementia, depression.
All the above.
Exactly.
Everything.
Dementia? Really?
Yes, it does.
Wow.
There are recent studies that have relate, lack of exercise with dementia, and then some studies have proved that exercise actually can improve mental processes in older people.
I want to ask a question about the bone density and osteoporosis. So we hear and we talk about osteoporosis, but mostly in the female population. Do men experience bone density loss as we age?
Yes, men experience not at the same rate as women, especially in the younger years. Definitely osteoporosis is related with, hormone deficiency and the estrogen.
Right.
That's why when women go through the, menopausal period in life, there's a higher chance of developing osteoporosis. Men don't go through that change, but men definitely can suffer from osteoporosis as well by lacking exercise, regular exercise, and a good diet.
Interesting. So now you're a family physician out in Snohomish with the Providence Group, and is your area of interest sports medicine and exercise? And what are you prescribing to your patients that come in and want to start an exercise program? Let's say someone like myself, I'm in my mid-40s, and maybe I haven't exercised and I want to get started. So what is your recommendation going to be?
Yeah, as a family doctor, I get to see all kinds of patients, and I do have an interest in sports medicine. And what I'm seeing is that most of the conditions that my patients, have now are related to lack of exercise and lifestyle. So, the first thing that I will recommend to you, first of all, I will ask you, how active you are, how many times are you exercising, how your diet is, if you feel like, you're eating well. You have to start with simple things as lifestyle that may not sound so simple because, it takes some sacrifice and willing to do, but I will start with that. And depending on how active you are already, then I will direct you into a more specific. If you don't exercise at all, then, that's the beginning. How can you start a good exercise program?
And you don't, and I'm speaking from experience here because, I smoked and, recently quit smoking. But everything goes good until you hit like the mid-40s. And then, if you don't exercise and you don't eat right and you smoke and you drink a lot, that's when things start going to, whatever, you know what I mean, falling apart.
Well, one of the things I experience in our practice of physical therapy is we prescribe exercise for patients, and when they're done with their physical therapy, I actually encourage them to maybe go to a gym or do it in their home. And as we age, we tend to get more of these tendinitis and strains and sprains and stuff a lot easier and quicker with her. And a lot of people stop exercising because they feel like they get hurt. So the exercise prescription should be gradual, slow, gradual progression into it. Would you agree?
Yeah, definitely. It has to be gradual, and it has to be personalized depending on the activity, the regular ability and activity of the person.
Right.
We're talking with Dr. Gina Cadena-Forney. That just kind of rolls off the tongue.
It does. You do a great job with that name.
Thank you very much. She's from the Providence Physicians Group in Snohomish. We're talking about the importance of fitness as we age. Why is flexibility important as we age?
Well, flexibility, first of all, what is flexibility? Flexibility is the ability of our body to bend without breaking.
Right.
So flexibility is very important because it helps to keep your body limber by stretching the muscles and tissues that hold your body structure together. So by staying limber, not only helps your balance, but it makes, make it easy to perform daily activities.
Stay flexible. Always stretch. I mean, people should be stretching before they even exercise.
Right. What do you suggest as far as like taking vitamins or, to keep your bones as you're working out in an older age? What should I take? Is it
glucosamine?
Yeah, is that a good thing to take? Or
I believe that if you have a healthy, balanced diet, you're getting, pretty much, all the vitamins and nutrients that you need. Of course, as you get older, especially in women, when they go through the menopausal stage, they do need to get, calcium and vitamin D because it's very important for the bones 3 times a day with meals. As a male, you can always get a multivitamin.
Right.
But it's very important that you do have a healthy, balanced diet. A lot of people think that, they can eat whatever they want, and because they are just taking their daily supplement, they are going to be good. So it's important, maybe changing that perspective.
That vitamin D is the big thing now. It's like the trendy vitamin to take for heart health and all that stuff.
Yeah, vitamin D is big right now, particularly in the male population. They're talking about vitamin D and preventing prostate cancer, aren't they?
Yeah.
Is that what it's going on right now?
Yes, that's what my doctor says.
Yeah, okay, your doctor says that.
Yeah.
Hey, let's get back. I want to talk about heart health because I know here in America, and particularly as we age, we tend to put on a lot of weight, and heart conditions are a big problem for everyone. So how does exercise promote a healthy heart? Give us some examples of that.
Well, regular exercise helps your heart. For example, a 30-minute walk per day at a medium pace of 3 miles per hour can reduce the risk of heart disease in women by as much as 40%. So that's a pretty significant number. So it helps your heart, it improves circulation, it helps with your breathing, it helps prevent or improve diabetes, helps prevent osteoporosis, helps control your weight, improves the quality of sleep, and it helps decrease your bad cholesterol. So it definitely has a lot of benefits. So
just overall health, walking, like you just said, walking, again, just a little bit. What is that walk, about 20 minutes, did you say?
30 minutes, 3 miles per hour, reduce your risk by about 40%.
That's pretty easy to do on a daily basis. What about blood pressure and exercise?
Definitely, it's related. As you exercise regularly, your blood pressure decreases too. And we know that blood pressure is linked to heart disease and diabetes and other conditions. So basically, everything falls kind of under the same problem.
Yeah, blood pressure is a whole topic, but it is a silent killer. And a lot of people have high blood pressure and don't even know it. How often do you recommend people check their blood pressure?
Well, it is recommended that, you do it at your annual physical, so basically once a year. Of course, if you do have problems with your blood pressure, then you have to have regular follow-ups with your family doctor, your primary care doctor. But if you don't have any problems with blood pressure, you should do it regularly, annually at your physical.
So let me ask you, as a physician...
You can even buy they sell blood pressure
cuffs.
Yeah,
and you can go to the grocery store and just get your blood pressure.
I like it. Some grocery stores is right by the meat, and they sit there and get your blood pressure. That's pretty good. Yeah.
So as a physician, if someone comes in and you have a patient that has marginally high blood pressure, kind of on the border there, is your first line of defense are you going to prescribe walking, exercise, or are you going to consider medication?
Yeah, that's going to be the first line of treatment. Is going to be lifestyle changes.
Okay.
And of course, it's going to depend on the other conditions that the patient has. If you're, dealing with a patient who has diabetes or heart disease, then that's a different scenario because you do have to control that right away. But if I see you said you're 40 and you come with borderline high blood pressure and you are otherwise healthy, I'm definitely gonna exercise the importance of lifestyle changes. Then we can check, your blood pressure 6 months later and see how that goes by losing some weight. And
so I just want everybody to really understand this blood pressure thing. Tell us some things that high blood pressure from a health standpoint, a bad health standpoint, can lead to.
Yeah, so high blood pressure, as you said, is a silent killer. That's what I tell my patients because, most of the people tell me, but doctor, I feel fine, I don't have any problems, but blood pressure is sky high. So, long-term consequences of high blood pressure, even before you develop any symptoms, it can damage your arteries by causing arteriosclerosis, which is hardening of the arteries, atherosclerosis, which is when your arteries start to collect fat. It can cause a heart disease by, leading to a heart attack, or it can enlarge your heart. It can damage the brain. It can damage the kidneys. It can damage your eyes. And other possible dangers include sexual dysfunction, bone loss, which is the osteoporosis, and trouble sleeping because there is an association between high blood pressure and sleep apnea.
Wow.
And death.
and all those things.
That will be your final consequence.
So a lot from what I find talking to people, like a lot of my friends now, is I'm telling you, like 99.9% of my friends are on cholesterol medication, blood pressure medication, and a very good percentage of them have sleep apnea machines. That's another big thing. So, I think people are becoming aware of the high blood pressure and cholesterol, and doing something about it,
Yeah, absolutely. There's a lot of public awareness now. But again, you have to get your blood pressure checked. You have to get in and get it checked. Like you said, either in the store, your family physician, but you should always get your blood pressure checked.
What age should people start worrying about their blood pressure?
Well, 30s, 40s, we are seeing people presenting with high blood pressure earlier these days because of lifestyle. We are seeing more obesity and weight problems, so that can definitely, lead to blood pressure. If you are in good shape, you're healthy, you always want to have your blood pressure checked, starting at your 30s. Definitely once you turn 40, you want to do it annually, unless, you have other risk factors prior to that age.
No, I don't even remember anybody even talking to me about it until I hit 40. How about you, Shannon?
I'm on the same page. Yeah. So, but it is one of those things you have to check, particularly in today's lifestyle. We're all so busy and, running around and, the diet situation. And, let's talk about as we age, too, we tend to just naturally put on weight, gain weight, I guess. Some of us do anyway. What is the cause for that? Is that because our metabolism is slowing down naturally? Is there a certain period in life where we were prone to put on weight?
Yeah, definitely. As we age, there is, first of all, a decrease on our physical ability. So this leads to a decrease in our metabolic rate. And metabolic rate is basically the amount of energy that we use on any given period of time. So, if as we get old, we have we decrease our physical abilities, that decreases our metabolism, we're burning less calories, and all this translates into weight gain. So basically it's because our metabolism slows down, but it doesn't have to be that way, because if you keep exercising regularly, if you...
It's the whole key right
it's
there.
the whole key. You got to keep your metabolism moving.
It hit me hard about 40.
Right.
All of a sudden, I mean, up until my 40s, I stayed pretty, within a good weight limitation or limits, and then all of a sudden, bam, at 40, I was gaining weight.
Yeah.
So here we are. I've got to start doing a little more exercise, probably.
More exercise. Yeah. That's what I tell my patients. It's just going to take you, 2 or 3 times the effort compared to when you were 20s, but you can still do it.
Yeah. Another hot topic out there right now in the world is this type 2 diabetes. And tell us what type 2 diabetes means and define that for us.
All right. So type 2 diabetes is basically what is diabetes. It's high sugars on your circulation. There are 2 types. Type 1, which is the one that we see presenting in kids and younger people. Type 2 diabetes is the one that you develop later in life. This is not a matter of an insulin problem from the pancreas, but rather than a resistance to the work of the insulin in the blood. Basically, the job of the insulin is take the glucose from the circulation inside the cell. So when the insulin is not making that work, it just lets the glucose or the sugar in your blood stay longer, and we know that that has a lot of complications and consequences. And we are seeing that this is more prevalent problem these days because of the same things that we've been talking about. The people are overweight, people are not exercising, they are not eating right, and that's why we are seeing even younger people these days developing type 2 diabetes, which we didn't see in the past.
Is it hereditary too? Sometimes?
Yeah, you have a higher chance of developing diabetes if you have a family history.
Right.
But it doesn't mean that if you're healthy and you're taking good care of yourself, you cannot prevent that. I guess you could relate that as a hereditary problem because of lifestyle changes, I guess, that you do inherit from your family.
Yeah,
right.
Yeah. But
type 1 is
more hereditary.
Mm-hmm.
But type 2, I mean, I think the thing to emphasize here is type 2 is a lifestyle problem more than it is a genetic problem.
Exactly. Yeah. It is more like lifestyle.
And that's more prevalent as you get older.
Exactly. Yeah. But, the concern is that because nowadays we're seeing more obese kids and children, they're actually developing earlier compared to the past. So that's a big problem. That's why we see now bariatric surgery, mm-hmm. and now that we have all these patients with diabetes, high blood pressure, heart disease, who are losing 100 pounds, and they don't have any problems anymore because it's all weight-related.
Huh.
Yeah, they have some great diabetic diets that the hospitals are doing now where type 2 diabetic patients are actually going on these diets, and the type 2 diabetes is actually going away. Is that right?
Exactly, yeah, but just as I'm saying, changing your lifestyle is going to decrease. The studies have shown that if you lose a mere 10 pounds, that can reduce your risk of developing diabetes by 60%.
Okay, let's say that again. So if you lose 10 pounds...
If you lose 10 pounds, that can reduce the risk of developing diabetes by 60%.
Wow, that's a pretty good...
So 20 pounds would be 120%.
All right.
Is this going to be on the test, by the way?
Always pick C. Always pick C. That is great information. Yeah. One more thing we should talk about is the balance problem. I know that as we get older, our balance becomes impaired for a number of reasons. We talked about poor muscle strength, poor coordination, but you can work on that, right?
Definitely. There are exercises that are designed for, in each of those components that we talked.
Why is it seems like as you get older, when you hear somebody falls down and breaks their hip, that seems to be the end. I mean, why is that? Because
why people are falling?
No. As far as if you break your hip, it seems to be like the end of the road.
If you fracture your hip and you're hospitalized and you're an elderly person, mm-hmm. it tends to be very debilitating.
Yeah.
And a lot of those people don't recover.
Yeah. And why is that?
Well, that is because first of all, we are seeing that most of the people who tend to fall are the ones who have poor balance.
Uh-huh.
Most of the time, people who are in not the greatest shape. Most of the time, people who have a lot of other conditions. So, if you add significant, major surgery is going to add a lot of more comorbidity to that person.
They don't bounce back as if they were younger. Their immune systems are shot. And,
exactly. Usually these people who fall, they have a lot of other conditions that make it really hard to recover.
Yeah, and when they're hospitalized, they're prone, because they become sedentary and they can't even be active because of the hip problem. They're prone to pneumonia and different complications.
And blood clots.
Yes. With falls and balance problems, particularly as we age, I just want everybody to know that physical therapists that's their area of expertise. That's where we're trained, and we actually, in our organization IRG, we actually have several clinics that have therapists that specialize in fall prevention and balance disorders. And once you have balance or falling problems, that's when you're susceptible to getting hurt and having those fractures and hip fractures, etc. So we can work with those folks.
Yeah, I just want to mention that 1 of 3 Americans over the age of 65 fall each year. So that's pretty significant. 1 out of 3, and among those individuals who are between the age of 65 to 85, those who fall, the falls account for 87% of all fractures.
Wow.
They fall. So
falling it leads to high risk fracture and then high risk other comorbidities, as you call them, or other problems. We can work on that strength and balance and get out and walk and keep exercising. And
you see them at the malls.
Yeah, the mall walkers. That's right.
They still do that?
Yeah. Oh yeah, there's mall walkers. Yeah. You should start walking the mall more.
That's good. No, I'm not ready for the mall. Because I'll stop at the donut place at the mall. That's my problem.
Mrs. Fields Cookies.
Yeah, I'll stop there. All right. Well, Dr. Forney, thank you so much for being with us today. It's a fascinating topic, and we could talk for like another half an hour.
Absolutely. We hit a lot of different topics that we need to drill down into. Totally. The diabetes, fall, balance, but we sure appreciate your time and your expertise and willing to come out and share that with us.
Sure.
For more information on the Providence Physician Group in Snohomish, we're going to put all of this up on the irgpt.com website, and you can find out more on there. You're listening to IRG Health Matters with Maureen and Shannon on the all-new North Sound 1380 KRKO Radio.